But globally, black people are 4 times more likely to die from COVID-19 than white people. And this is according to the United States and UK studies. As the story of the coronavirus pandemic continues to unfold, data is revealing an overrepresentation of black people as well as black women, both in rates of infection, in prognosis and mortality from COVID-19. For more on the story, I'm joined now by Bonang Mohale, who is the Free State University Chancellor. Lovely to be talking to you once again, Bonang. First of all, what is it that spurred you to do this type of research and write this paper after your analysis?
I think what COVID-19 has done for all of us is to demonstrate beyond any shadow of doubt the deep, systemic and systematic but structural inequalities, grotesque, self-perpetuating vicious cycle of abject poverty on the other hand, and on the other, where people could buy a 30 million rand house and demolish it in order just to build an extended garden for themselves. So when we look at COVID-19, which is unprecedented, unrelenting, and uncertain, a number of things come to the fore. First, there are 3 or 4 things that we must do to make sure that at the personal level, we do indeed remain safe. We talk about work from home. We talk about self-quarantine. We talk about self-isolation and indeed wash your hands. But even those bare basics in South Africa, of the 58.78 million South Africans, they are unable to fulfill those, not because of their own free volition, just because structurally 26 years into democracy, we haven't dealt with those issues. Look at Alexander, even the statistics, we don't know whether we have 150,000 people or 780,000 people, but Stats SA say anything in between. In an area slightly smaller than 6,000 square kilometers. In Soweto, we talk about more than 2 million people. It's closer to 2.5 million people, more than the population of Botswana, Namibia, Lesotho and Swaziland countries, and yet you find these numbers in Soweto. Most of the houses are informal settlements, single-bedroomed houses. The majority are 4-roomed houses with only 2 bedrooms, but on average, 5 people live in that. So when you say go and self-isolate, there's only 2 bedrooms, there's 5 of you, how can it be done? When you say to people, go and practice self-quarantine in Alexander, where people are literally living on top of each other, how can they do that? Lastly, when you say, wash your hands for a minimum of 20 seconds with soap, and yet we have not adequately provided water, especially in rural areas, but also in rural schools. So you can see that we are unable to. And the paper makes the point, using dispassionate facts, that actually it is deep structural racism in the world, it is racism in South Africa, and we have not all collectively succeeded in eradicating the legacy of apartheid.
One of the points that you make, Mohale, is that you say health disparities are fundamentally a political problem. So this goes beyond COVID-19, but into other health conditions as well.
You are absolutely correct, Sister Thami, because gone are the days when the electorate used only to expect from their governments houses, roads, bridges and dams. Now they need to start demanding good, accessible healthcare, but also issues of social justice. Gone are the days when we as individuals used to look at the old ways of doing things. We ought to be saying, how do we press the reset button because of this opportunity presented by COVID-19 in the way that we greet, in the way that we celebrate, in the way that we worship, in the way that we bury our dead. Social distancing has now become the norm. Can we together craft, co-create a better normal, not an old normal? Lastly, even this thing called the world of work. Now I find I do on average 6 meetings a day because I don't have to drive from one venue to the other. I use data, whether it's Zoom or Skype or Microsoft Teams or Blue Jeans, but are much more productive. Half of the people that have now become used to this are not going to go back to bricks and mortar. But also it has changed the way we as lecturers engage, interact, and interface with our students. Because now, instead of just standing in front of a class of 150, actually you can reach 2 million people. Competition has now been on steroids, because now people in California, in Montreux and Nkandla, but also in Madrid and in Canada, can be able to listen to you. The competition we are not taking to them, but also people now have access to Harvard and Stanford.
And that's another point that you're making, Thami Ngubeni. You talk about the digital inequality. There is a class of people or a section of people who are able to access that, and opportunities and pandemics like COVID-19 have opened them up to that. But there's another group of people that, because of the digital inequality, don't have access to that, who don't have the option of staying at home and working from home, who have to travel in taxis that are 100% capacity to work every single day, and they don't have that option. And this speaks to, once again, this political inequality that you refer to.
Absolutely. So the digital inequality is beautifully captured in the statistics of Stat SA, because they confirm that only 10.4% of households have direct access to the internet. When you look at that, you can only but marvel at how we are then going to respond. Because when you put your people in 100% full taxi with a laptop and a smartphone to say go and work from home, is the shortest way of ensuring that these are going to be indeed confiscated. The other thing that sometimes we forget is that you will be lucky in Soweto, in this four-roomed house, that you've got one cell phone, and lucky if that is a smartphone. But if you live in Bryanston, of course, you've got multiple devices. You could be upstairs and holding a meeting like this. Your kids downstairs could be doing their homework. Your wife could be having a meeting with her colleagues and indeed her own business using another device. But unfortunately, if you live in an informal settlement, how would you do that? Private schools have continued to teach their kids. They've been able to connect and reconnect even with grade R's to say, don't forget me as a teacher, this is how I look like. They are still doing their homework. But since the 26th of March, when the president made the announcement of the national lockdown, starting with alert level number 5, and gave us 4 days to get ready, starting on the 29th, I can tell you the majority of black schools and township schools, that's the last time they heard from school, that's the last time they saw their teachers, and indeed, until the schools were reopened and then closed again, they have not been doing any work. In fact, the teachers have used this as some sort of a holiday rather than really redoubling our effort and saying, when the fisherwomen and the fishermen cannot go out to sea, they repair their nets. What are we doing as a country, as a people with great natural endowments, to repair our own nets?
I wonder your thoughts, and Thami Ngubeni, regarding the NHI. COVID-19 comes at the backdrop of that, when the country is wanting to propel the NHI. How has the way that South Africa has dealt with COVID-19 reflect on our ability to implement the NHI?
So national health insurance, nobody can argue with it being needed in this country when so many of us dare to hope that joy and peace will prevail. Because what we all want is accessible, it's affordable, and equitable healthcare. And what a majority of our people don't have is actually access. We are signatories to the United Nations documents that we co-signed in 2019 that, again, talk to the issues of social justice. But you don't even have to go to the best document in our country, which is our constitution, but just the preamble, because it starts by saying we the people, not the politicians. In the body of that, it says recognizing the past injustices. So it actually mandates you and I to correct the past injustices. But 26 years into democracy, in fact, some would argue that in terms of healthcare, access to water, we experienced rolling blackouts in January of 2008 12 years later, we have not fixed the challenges of Eskom, and yet we want to be globally competitive. And we know what is wrong. We have put in plans in place, and we know the 4 things that we have to do. Of the 10% that is being owed of the 495 billion debt that Eskom has, probably 18 billion of it we know it's non-payment from Soweto. About 20 billion is from municipalities. All those people you can access. In National Treasury, they can say, as we give you your allocation, we are going to deduct what you owe to Eskom and give it to them, so that at least our state-owned enterprises and state-owned companies continue to deliver on their confused but dual mandates of development, but also of commercial.
And unfortunately, we'll have to leave it at that for this afternoon. A really engaging conversation there. Thank you so much, Ndata Mohale. That's Bonang Mohale, and he is the Free State University Chancellor.